Hi, a common question I wanted to answer was, do I need imaging before I get chiropractic treatment? So I'm going to give two answers here, and I'll explain on both of them. So the first answer I would say is it depends. Depends on the injury, depends what's going on. There's a few guidelines, things we kind of follow to be able to assess that situation. Second answer I would say is most of the time it is not necessary to get chiropractic treatment. So I'll address the first one, it depends. So there's certain situations or certain symptoms, red flags that want to be aware of or be concerned about. Some of those would be like for an upper body injury, if you're getting some of these symptoms because for like chronic situations, so you've been to other providers, you've tried a lot of things, and you're still getting these symptoms and nothing's helping it better. So I'd say, okay, let's get some imaging, see what's going on in here. So that's one situation. Another situation would be like for a neck injury or anything like that, if you get some significant or concurrent symptoms such as like sudden loss of hearing, changes in vision, swallowing, severe massive headaches that you're not used to getting, things like that are really like, yeah, there's some red flags there, or some and then for lower body, things like bowel and bladder changes. So if you're unable to urinate after getting some low back pain or just in general, it's one of those like this could be something pretty serious and we want to get some imaging. And then depending on those situations, whether we do an x-ray, MRI, again, case by case scenario that we'd have to address. Other scenarios that might require imaging would be some of these significant traumas that come in, like car accidents. Usually it's a scenario where it's like we need to just make sure everything's good. And then addressing the other side of that question is most of the time no. So most of the time, a lot of the injuries that come into a chiropractic office, I mean, most scenarios are sprains, strains, things like that, which can happen in a lot of different causes or concerns. And just in one sense, x-ray is not going to show anything on that. So getting an x-ray looking for a sprain, it's not really something that I need. It's not going to tell me anything more, and for the most part, it's not a necessity. And so we can be able to address a lot of those scenarios without having to do imaging. The other one sometimes you get is some of those symptoms going down the hands, into the feet, and guidelines typically will lean towards, all right, let's have a trial of treatment for 2 to 3 weeks, see if there's any improvement. If there's not, then imaging would be completely appropriate. So it's definitely something that we can address case by case, but it's also something that for the most part, coming into a chiropractic office, it's not something that has to be done. And the other piece of that I'll mention that was kind of interesting they've shown with the research recently that was people with low back pain that get a MRI early in the condition, that they usually have worse outcomes than those who don't. So going in sometimes and looking at the problems, hoping to find the answer with imaging, the easy answer there is imaging is not the full picture. So it's going to give you a few different things, and it may just make things in your head get a lot worse. So they've shown that have worse outcomes. So again, answering the question, no, it's not necessary. Sometimes it is, but addressing that case by case. But hopefully that answers your question. I'm Dr. Darren Howarth with Summit to Shore Chiropractic. If you have any other questions, let me know, and we'll talk to you soon. Have a good day.